Introduction to electric burns. Electric burns are injuries caused by electrical currents passing through the body. They can cause severe internal damage even if the skin damage appears minor. Prompt and proper first aid is crucial to minimize damage and prevent complications. This guide covers essential steps in providing first aid for electric burns. Safety first, turn off the power source. Before approaching the injured person, ensure your own safety by turning off the power source. Do not touch the person if they are still in contact with the electrical source. If you cannot turn off the power, use a non-conductive object to separate the person from the source. Check for responsiveness and breathing. After ensuring the power is off, check if the person is responsive and breathing. Call emergency services immediately, even if the person seems fine. If the person is not breathing, start CPR if you are trained to do so. Assess and treat the burn area. Look for entry and exit wounds where the electricity has entered and left the body. Cool the burn with cool running water for at least 10 minutes. Do not use ice or apply ointments, creams, or butter to the burn area. Cover the burn. After cooling the burn, cover it with a sterile, non-stick bandage or clean cloth. Avoid using fluffy materials that could shed fibers into the wound. Keep the burn area clean and dry to prevent infection. Monitor for shock. Electric burns can cause shock, a life-threatening condition. Signs of shock include pale, clammy skin, weakness, dizziness, and fainting. If the person shows signs of shock, lay them down with their legs elevated and cover them with a blanket. Do not apply household remedies. Avoid applying household remedies like butter, oils, or ice to the burn area. These can cause more damage and increase the risk of infection. Stick to clean, sterile dressings and seek professional medical care. Seek immediate medical attention. Electric burns require professional medical evaluation and treatment. Even if the burn appears minor, internal damage may be severe. Follow up with a healthcare provider for a thorough examination and further care. Prevention of electric burns. To prevent electric burns, practice electrical safety at home and work. Ensure that electrical outlets and appliances are in good condition. Use protective equipment when working with electricity and never handle electrical devices with wet hands. Differentiating electric current burns and flash burns. Electric current burns occur when an electric current passes through the body, causing internal and external damage. These burns are often severe and may result in entry and exit wounds. Flash burns, on the other hand, are caused by an electric arc or explosion, affecting only the surface of the skin and not penetrating the body. Flash burns can result in extensive surface damage. Additional differences between electric current burns and flash burns. Electric current burns can cause deep tissue damage, affecting muscles, nerves, and bones, and are often accompanied by cardiovascular complications. Flash burns primarily damage the skin surface and may also cause eye injuries due to the intense light produced. Both types of burns require immediate medical attention, but the treatment approach may vary based on the type and severity of the burn. Conclusion and summary. Electric burns are serious injuries that require immediate first aid and medical attention. Remember to turn off the power source, assess the situation, and provide appropriate care. Educating yourself and others about electric burn first aid can help save lives and minimize injuries. Important notice: this presentation is for informational purposes only. Always contact a medical expert for treatment. Download the Burn Aid app for free from the Play Store or App Store for more detailed guidance on burn care and first aid.